Hey, I'm Alex. I'm the Senior Psychologist at Wildflower Holistic Services. Many people kind of come to us for assessments, and many people also ask us about, why should one get assessed, or I guess what's the benefit of it? And it's a really, really good question. And for us, it's really about really seeing, really hearing, and really understanding one for who they are. Many individuals often kind of walk through life feeling really misunderstood, and being, I guess, assessed and then diagnosed, if that's the relevant path, it really kind of opens their eyes up to a lot of different things. But for once they kind of feel really understood, or they feel really seen, or they just feel like life kind of makes sense to them. And so I guess with our little legends that we assess, they don't necessarily have choice, so to speak, within that matter, because it's something that's kind of, directed by the school or a pediatrician or the parent. But I know for a lot of our adolescents and our adults, for them, they really kind of report how kind of life-changing it is in a number of different ways. But it's more that they just feel understood and life makes sense to them. So for our little legends who are assessed, it does kind of give them like a leg up in different ways, because they can kind of navigate their life with a better understanding as to how it is that their brain works and why they interact in different ways and what is needed to kind of best suit them, as opposed to some of our teenagers and adults who kind of go through life really navigating and struggling in a lot of different ways, and then kind of being like, where there's a lot that could kind of be put in place prior to kind of getting to that stage. So I guess if you're watching this, then you've read a blog about like autism in women and young girls. And yeah, it's a really big kind of topic, and it's something that we're really passionate about here at Wildflowers, because so many of our women are really misdiagnosed, they're misunderstood, and they're just like struggling for one reason or another, which, is completely understandable, because we too, or I too, would be struggling if I didn't kind of necessarily understand what was going on for me, or why some people found things really easy and I found it really challenging, and like, is there something wrong with me, or why is this happening? Or and a lot of our healthcare professions aren't necessarily always equipped to really understand autism in our women and girls, because it looks so different. And I'm not sure, like, if you're probably watching this and you've probably kind of heard or have your own kind of idea as to around what autism looks like, or what people have kind of said autism is, but then you're still kind of questioning whether or not you may have autism, or whether or not your teenager or young girl may. And I think if you're really kind of questioning that, then it's something to really reflect on, and it has weight to it, and it means something as well. And it's about finding those right people who kind of really understand autism in our female population, to then be able to really kind of support and navigate how it shows up for that person, compared to like what people kind of portray or believe autism to kind of be, because it really is a spectrum and it looks so different for so many different people. But in terms of our, I guess, like assessment process, it looks different for different age groups. So our little legends is kind of anyone that I would say is under 12. With them, we meet with you guys as the parents or the caregiver, have a conversation in and around a number of kind of things that you're observing, and we kind of just get a really good feel and understanding as to who it is that we may have the pleasure to kind of work with and see. And then from there, we send out a number of questionnaires to both yourself and to the school. It's really important to kind of get the school's input. And I know for many of you who kind of be like, well, what happens when they mask and, the school doesn't kind of really see it? That's okay. That's okay. It's okay if we send out the questionnaire and the school's like, no, I don't see it. We are trained to work with our high masking individuals, or for those who kind of really internalize or, show up differently in a school environment. we do that to kind of help kind of tick our boxes. And you know, you never know what the school kind of does come back with. And then we obviously meet with the young person as well, and we will do like an in-house diagnostic assessment. So that may look like an ADOS depending on the age, or we may also use the MIGDAS. And then we meet with you guys as parents to kind of discuss the results and what that looks like next. For our adolescent girls, and also sometimes for our like maybe 10, 11, 12, girls with really high masking presentations, we often will take the same approach as what we do with our adolescent girls. And that's, again, like meeting with you guys as a parent and caregiver. We'll send questionnaires both to yourself, and depending on the age, we'll actually send questionnaires to the individual that we're going to assess to kind of really get their thoughts and feedback on what it is that may be going on for them. And for many, they kind of report how insightful that is, because they don't necessarily realize the difficulties or challenges or what it is that, they're experiencing may be expressed or explained by other things. It really kind of gives them a bit of an insight too. And then we will meet with them and go through the MIGDAS as the, I guess, like in-house diagnostic assessment. And in terms of our adults, it's kind of a similar process, if I'm honest, to our adolescent girls. But obviously in these settings, it's more just like communicating with yourself, you yourself kind of completing questionnaires. Sometimes if you're open to it, and depending on the situation that you're in, you may get other family members to complete it, or your partner to complete it, to give kind of a bit of like an insight. And then again, it's meeting with you and kind of asking a lot of questions and exploring all the subtleties and what it really looks like in women. So it kind of just looks like a bit of a conversation and a bit of a chat. It is brought on with like a lot of questions, but it's more just to try and understand what it is that's going on for you, and how it is that you may be experiencing like difficulties in certain kind of aspects of your life. And then for all the assessments, we write a really detailed report that kind of really answers a lot of questions that many people have, but also starts to kind of highlight what it is that may be going on and how it is that you can then kind of like move forward within the world, and what supports that are best going to kind of work for you. I know for many of the adults that we've worked with, they've found the reports to be really reflective of who it is that they are. And it's kind of really nice and confronting in different ways to kind of read something back that's so, that is you, and that someone's kind of taken the time to really kind of understand a person and reflect that back in a written way. Many of our kind of parents report the usefulness of the report in terms of moving forward into like school or other healthcare professional settings, but also about the steps that they need to take to kind of move forward to best support someone. I think that's everything that I have to kind of say in that space. But I guess if you're thinking about an assessment, we do both in-person and telehealth, so online assessments. So you don't have to be located within our like local region for that. The only time that we really may not do an online assessment is for our younger girls. So I would probably say anyone under 8 years of age, I wouldn't necessarily feel comfortable doing online. But at the same time, like I know sometimes it's really hard to access healthcare services depending on where people are like located. So please don't hesitate to give us a call, and then we can kind of assess the situation and go from there in terms of what it is that we may be able to do to best support you within that space.